So I perform shoulder replacement surgery as well. There's two distinct types of shoulder replacements, and each replacement is done for a specific reason. Most shoulder replacements are done because of arthritis. And arthritis is when this is a model of a shoulder ball and a shoulder socket. It would be kind of like this. And this is just showing that the smooth cartilage has rubbed down, and now we have angry bone end, which is painful. Same thing on the socket. All the smooth cartilage which covers the socket is rubbed off, worn out, and now we have this representation of an angry shoulder joint that has more friction and more pain. When we have an angry or worn out shoulder joint, just like a hip or knee, the surgical option is to put a new shoulder joint in. That means we're replacing the ball portion with a metallic ball and the socket portion with a high-density plastic socket. These are implanted in. We fashion the socket, and it gets implanted. Same thing on the humeral bone or the arm bone. We have to put a rod down the center, which allows that to anchor in place. And these provide smooth surfaces that are pain-free. This is an anatomic replacement. For anatomic replacement, the muscles which power the shoulder, called the rotator cuff, would need to be intact for this. If we have arthritis of the ball and socket joint, but a bad rotator cuff, it's torn, it's been operated on multiple times. When I test it in the office, it feels very weak. The MRI shows me that there's damage to the rotator cuff. Well, then we do a special replacement called a reverse replacement. In this case, this is the patient's shoulder blade. We attach a titanium base plate very strongly to the shoulder blade, and then a ball is attached there to the original socket area, and a new socket or dish is attached to the arm bone area, to the humerus area, and then these two snap in together like that. The reverse replacement treats arthritis of the ball and socket joint with a bad rotator cuff. This fools other muscles around the shoulder to act like a rotator cuff. So this restores function and decreases pain. Really successful surgery. This one we typically do in our above 60s population, and the other replacement typically in our under 60s population. You have to do the right surgery for the right problem though, but highly successful in both respects.